Gynecomastia is a medical term for abnormal breast development in men. Gynecomastia affects an estimated 40 to 60% of men. It may affect only one breast or both. Though certain drugs and medical problems have been linked with male breast development, there is no known cause in the vast majority of cases. For men who feel self-conscious about their appearance, breast reduction surgery for gynecomastia can help. The procedure removes fat and or glandular tissue from the breast, and in extreme cases removes excess skin, resulting in a chest that is flatter, firmer, and better contoured. If you're considering surgery to correct gynecomastia, this video will give you a basic understanding of the procedure, when it can help, how it's performed, and what results you can expect. It can't answer all of your questions since a lot depends upon your individual circumstances. During your personal consultation, we'll review the procedure and discuss any items that you don't understand. Surgery to correct gynecomastia can be performed on healthy, emotionally stable men of any age. The best candidates for surgery have firm, elastic skin that will reshape to the body's new contour. Surgery may be discouraged for obese men or for overweight men who have not first attempted to correct the problem with exercise or weight loss. Also, individuals who drink excessively or smoke marijuana are usually not considered good candidates for surgery. These drugs, along with anabolic steroids, may cause gynecomastia. Therefore, patients are first directed to stop the use of these drugs to see if the breast fullness will diminish before surgery is considered an option. The temporary effects of breast reduction include loss of breast sensation or numbness, which may last up to a year. During your examination, your breast will be examined and checked for causes of gynecomastia, such as impaired liver function, use of estrogen-containing medications, or anabolic steroids. If a medical problem is the suspected cause, you'll be referred to an appropriate specialist. At the time of your examination, we may be able to determine how much fat and glandular tissue is contained within the breasts. This will help to determine the appropriate surgical technique. Surgery for gynecomastia is most often performed as an outpatient procedure. Smaller types of gynecomastia may be corrected under local anesthesia alone. Larger cases are typically performed under a general anesthetic. If your gynecomastia consists primarily of excessive fatty tissue, liposuction can typically be used to remove the excess fat. A small incision, less than a half an inch in length, is made around the edge of the areola, the dark skin that surrounds the nipple. A slim, hollow tube called a cannula, which is attached to a vacuum pump, is then inserted into the incision. The cannula is used to break up the fat, then it's removed using a strong suction pump. If there is excess glandular tissue, it will be excised or cut out with a scalpel. The excision may be performed alone or in conjunction with liposuction. In a typical procedure, an incision is made in an inconspicuous location, usually around the base of the areola. Working through the incision, the excess glandular tissue, fat, and skin around the areola and from the sides and bottom of the breast is removed. In extreme cases where large amounts of fat or gland tissue have been removed, the skin may not adjust well to the new, smaller breast contour. In these cases, excess skin may have to be removed. Sometimes a small drain is inserted through a separate incision to draw off excess fluids. The chest may be wrapped to keep the skin firmly in place. There will be some discomfort for a few days after surgery. However, discomfort can be controlled with medications. You'll be swollen and bruised for a while. To help reduce swelling, you'll probably be instructed to wear an elastic pressure garment continuously for a week or so. Although the worst of your swelling will dissipate in the first few weeks, it may be 3 months or more before the final results of surgery are apparent. You'll be encouraged to begin walking around on the day of surgery and can return to work when you feel well enough, which could be as early as a day or two after surgery. Any stitches will be generally removed about 1 or 2 weeks following the procedure. Gynecomastia surgery can enhance your appearance and self-confidence. Before you decide to have surgery, think carefully about your expectations. The results of the procedure are significant and permanent. If your expectations are realistic, chances are good that you'll be very satisfied with your new look. Thank you.